Hi, I'm Dr. Pannozzo. Thanks for watching our program. The patients you're going to see are regular patients from my practice. Whatever they say on camera is how they feel and what they want you to know. So enjoy the program, and if you have any questions, write in and we'll answer them. Thank you. Well, when you have a bad injury, this is what we're looking at. I mean, this is all new stuff, you know. Nobody does this in the whole world.
No, well, you know what? My wife looked some stuff up on it, and there's a guy in Germany that's doing it.
Doing what?
Same thing for the ringing in the ear.
He's doing what?
I think he's putting cortisone in there or something. I don't really
Well,
know.
Howard, tell me where to read that, because I want to know if he's doing what we're doing. Probably not.
It didn't kind of sound the same, but I will definitely look it up for you. I think all she did was type in ringing of the ear, and then that category came up, and then she typed in using cortisone shots or something.
That was catchy. I'm trying to think.
That was pretty good.
That was. Especially that little. That was good.
Yeah, some of those great tunes aren't very complex on the piano when you play them,
Yeah, they're pretty.
but they really sound good. Why do they sound good? Because they're all in the same octave? Yeah.
Could be.
You can't jump octaves.
Yep.
Or you could, but it has to be, I don't know what I'm talking about.
I'm trying to check out the ringing in the ear thing in Germany.
He's doing it too. You better turn your camera off when I do.
So, can you say what you just said?
I said, there it goes.
There goes what?
The ringing in my ears. He did this side, my left side on Tuesday, Tuesday, and then I came in here on Thursday, and he did this side, all gone. So,
That is so interesting. And the thing is, you don't know if he's telling the truth or not. There's no test for this that I know of. But I believe the patient when they say they have it and then they don't. I believe it. That works. Okay.
Yeah, me too. It's not something you go around and fake.
Brilliant, I guess is a good word.
Magician.
He's a student of his profession.
How you doing?
This is my son Cameron. He's seen me suffer through lots of pain.
Yeah.
So you want me to just give him? You want to see shirt off kind of thing?
Yeah, we have to
Okay.
see where we're
modeling.
No, I'm not really modeling.
Yes, you are.
Wait a minute. I don't think I signed up for that. Yeah. So let's do this. Okay.
Bend forward a little bit. I think it's right there.
Yeah, that's part of it.
And that's all right. That
Yeah, that one too. And that doesn't hurt, but it's tension on it. So that one right there where you just were, is probably.
This one?
Yeah, the most, maybe a little bit. All right.
It's like 8, 9.
Okay, it could be 7, 8, because it might have been there and a little
Yeah,
higher.
it's one of those.
Got 10
This is rotated though. You could actually feel it. Okay. have a seat.
Number 8 is rotated?
Yeah.
8, 9? So is it like more forward, or is it more left to right, or right to left? You didn't hear me.
Say it again when you come.
Okay.
Put your forehead on you.
Yeah.
Say it. You want a sheet there?
No sheet.
Okay.
That would explain.
Wait, what are you getting done? Shot?
Yeah,
Not screwed up.
You can handle that.
I hate shots.
it's, yeah, but the thing is he's
These are different though. The
It
needles
helps,
are really thin and
Yeah.
they're not like, you know,
so,
Just then.
so is it, when you say it's rotated, is it rotated left to right, or right to left, or forward?
It's rotated to the right.
To the right, meaning that the left side is back too far.
Yeah. It's way down in there. And the right side is right up in here. There you go.
Good.
that's it.
Not the big one.
Are you having your shoulder done?
I don't know, I don't know that I need it.
Maybe you don't. Maybe that's what was preventing your movement.
Up top, you mean?
Yeah, could be. Ask him though.
Did he do one on the left side?
I think he did
You
your
should
shoulder.
both.
Did left and right?
Yeah.
Yeah.
Yeah, so it's, all right, so if you want feedback results, or feedback from what happened last, my back has been, very badly locked up, and because it was very badly locked up, the nerves were pinched a lot, and it was causing the muscles to fire a lot. And I actually have, a lot of problems where the pain would radiate to many other parts of my spine, up my spine mostly. And it would also result in headaches, and I would compensate a lot for like movement and things like that, but I would push through the pain just to try to, get through my day and do the things I needed to do. But as it turns out, done to this point, which has been taking care of problems that I've had for many years. Just after a couple of visits, first visit was improved, second visit was better, and here's my third time working on this area, but I can tell you that it has been much improved, and just because I know how good it is to feel good, I wanted to continue a little bit further just to see if I can't get the last little bit squared away. So I didn't know that I felt as bad as I felt until I
So I
saw.
felt that's good.
Yeah,
Yeah, that's a good way to put it.
yeah. So that's my
Absolutely.
that's my testimonial. I'm sticking to it.
Cool. Great.
All right. Sorry to put you through that,
No
but
problem.
that's the inside dope. Which is probably me. I'm the inside dope. Anyway, what's going on?
Well, I've had lower back pain for quite some time, right in through here. Predominantly more, lately I'm more on the the left side.
Left side's worse?
Yeah.
Does it go in your buttock or leg?
No, it just stays straight there, right in the lower back.
And you have trouble bending?
Not normally, no. I have, the trouble is when I sit at a chair and
You get up?
then I get up, and because I've sat so long, that causes it to, basically
How long have you had
freeze
this?
up. Oh, I've had back pains on and off for years.
Any treatments on it?
Just from chiropractor. No surgery.
Anything else beside the chiropractor?
No, my back.
All right, do you have it in the morning?
Usually at nighttime.
Does it wake you up?
No. No, but it doesn't wake me up because I think I'm just so used to it, you know.
No.
Something
If it was
like that.
bad, it would wake you up. You can't get used to it, I'm telling you. Let's see. Again, we're gonna rotate your hip here.
Mhm.
Ugh. It's always the right one. Now this is a hip. Yep. Okay, there's a hip, the second picture there.
Mhm.
You see there's a lot of gray there.
Mhm.
That's a ligament around the hip joint. And for some reason you hurt this.
Mm.
So this will give you a pain right through there.
Okay.
Is that what you get? It'll also give you a pain sitting and arising.
Okay.
So you don't have a backache. How about that?
Okay.
All right, just stand right here.
Sure.
And turn this way, please. There you go. And bring the shirt up so I can see it back.
Mhm.
All right, go ahead and bend forward now. We're looking for a pain. If you get a pain, put your
Right there.
Where is it? Put your finger on it.
Right there.
Right here. Got it. Okay, come back up. Bend backwards. Okay, go left.
Oh, right there, yeah.
And-
That hurts when I go left.
And to the right.
It hurts that much.
Do you feel it in here?
No, right there.
Just right there.
Mm-hmm.
There you go, for this one. Left. The two problems here. How about that? Okay. Good. The thing we're trying to find out is the localization of the structure. We want to find out the structure that's causing the pain. And you had two problems here, and they commingle. So there could be something common to both of them. So we're going to take a picture that we do here. It's a special film, and it's only one shot, but it's a special weight-bearing film. It's standing. And then we already know what's wrong with you, so then we'll point it out to you. Then we're going to see what we have to do to fix it.
Okay.
And then I'll offer it to you.
Okay.
Treatment.
Okay.
Don't say no. All right, come with me. I don't know if you can see this white here. Do you see that?
Mm-hmm.
You don't see it on that side.
Right.
This is what the body does to correct the strain. It's a ligament, and it throws down calcium to heal it. So that's what you have there. Now the reason you have that is because the leg is shorter. In other words, you have this is lower here. This is lower than this. You see it? Your whole pelvis is low, and that's why you have all this pain. So you got this pain, and you got this pain. I think it's one of these two. It's either this one or this one.
Mm-hmm.
I couldn't tell, but because you have no referral. So it's going to be right here, right? Okay.
Right.
So I'm figuring it's this one. I'll
Right.
find this one. In fact, I wrote it down. Look at that. Right. So that's the whole deal there. Now you can correct all of this, but just by raising your right leg. Takes the stress right off. But if you want pain relief, I mean, really good pain relief, quick, then you take shots for it.
What kind of shots?
It's anti-inflammatory.
Anti-inflammatory shots.
We won't put hair in your chest if you don't have it already.
Yeah. Don't have it in my head either, so that's no big deal.
Yeah, right.
And how often are the shots?
Once. This is for your right. It's a 1/4 inch. So
I just put that in your shoe,
just put that in your right heel. Go ahead right now. Put it on. There's a chair right over there.
and that'll make it work.
And that'll make it work, right. Pain is an engineering problem. It's a failure to bear weight. You see, so you have to figure out failure to bear weight of what? Ligament structure. Yeah, it's not what you think. It's not an MRI like they try to tell you. That's why I had trouble with that guy on the phone. He was here. Well, you don't want to record that.
Feeling different. Right now, I mean,
What was the comment?
He's feeling different.
Oh.
yeah, I mean, wow.
This is unsolicited, folks.
Feels like I walk easier. Feels like I walk easier.
Yeah.
It really does. It feels like I walk easier.
Yeah.
Okay.
Now, you can let it go at that and see how you do.
Yeah, let's try that.
And, wait a couple of days. If you're not,
Okay.
if anything doesn't feel better, then come in. We do 2 shots and you're done.
Okay.
So not everybody gets a shot.
I just continue this all the time.
Yeah.
No matter what.
It's an engineering problem, not an MRI problem. You gotta understand that.
Okay.
This was the problem with the guy that called me on the phone. See, he was here 3 times, was operating.
Your doctor said do anything but don't have back surgery.
Yep.
Because he said back surgery is never successful.
Right. He's right. And the main thing is that every time, see, scar tissue is the problem that causes the pain, scar tissue, ligament. And when you get operated, you get more of it.
Oh, okay.
So,
That makes sense.
Today the 20th.
Yeah.
yeah, so I feel bad for that guy because he got talked into some surgery and he's gonna feel better for a couple of months.
Right.
All come back.
Right. No, that's what they said. Don't do any surgery. Just do anything but.
Yeah.
As a matter of fact.
Oh, sign this. What- Arcadia, Florida, right?
Yes, Doc, I'm
And
sorry.
which is it good?
34266.
Okay, what do you want me to look at?
Doc, my entire joints are hurting me, especially my shoulder. I can't sleep at night.
Shoulder, which one?
Both of them, but the right one is worse. I can't even tie my hair. It's like awful. And I tried to take some. Before, my arthritis doctor gave me like a prednisone, and I know it's not good. And he even told me that it's not really good for me. So I just take it like once a while. But I ran out. I said I can't survive having that all the time. It's not good.
How long is the shoulder? It's the shoulder? How
The
long has it
shoulder,
bothered you?
it's been bothering me like probably 2 months now.
2 months.
But this few weeks is the worst.
How did you get it?
Oh, I think it's part of my arthritis though. No? But it's like, I feel like,
Yeah, how did you get it? Did you fall on it?
no,
Lift?
my job is not heavy
Does
really.
your neck hurt?
Yes.
Oh. Which side?
It's actually doc here and here.
Right side.
When sometimes I get headache with that.
Headache with it? Get dizzy?
Sometimes. Oh Lord. I thought it was part of my arthritis because I have a bad RA.
I don't see it. Where's your RA at?
My fingers and my
Where? I don't
joints.
see it. Show it to me.
See, this is the reason why I got my hands like,
Well, this is just scar tissue in here, that's all. This comes right out.
oh really?
If you know how to treat it. You can't go to an arthritis doctor and not have some kind of cure. I mean, first of all, there's no such thing as arthritis.
Yeah, I actually did.
You gotta have a name on it.
I actually did Humira.
Humira?
And I tried it last December, I believe, or last year actually. And it's too expensive. And I tried to take a shot for that, and yeah, I don't know how to do it because I'm scared of needle. My husband does it. Every time I took a shot, I had to sleep because it's painful. But the next day I feel relieved. I was good till 2 weeks, and then it went back again. So until the doctor gave me like every week shots, and I read the thing in the paper, said, oh no, it's scary. So I said I will probably find somehow. I'm taking supplements and stuff.
Does anything wake you up at night?
Pain.
Where?
Most of the time, sometimes doc, it's in my joints. Most of the time my joints, my knee, my shoulder. This time lately it's my shoulder. My right shoulder is the one that's bad.
So you take a prednisone once in a while, that's it?
Yeah, I'm out of it, so I won't be able to get it until I go back to my arthritis doctor. But I was thinking that I keep coming back, I keep having the same problem, so...
How long have you been treated for this? 2 months or longer?
I've been, for the prednisone, for this arthritis, I've been seeing arthritis doctor since 2013. I changed one.
From 2013?
Yeah, and then I changed my arthritis doctor because it keeps giving me like blood work and then explain to me, and same thing, sulfasalazine and stuff like that. So last year I switched a doctor, and that's where I get into a Humira. So,
You have anything else besides pills? Any other treatment?
no.
Well, I don't quite understand that, because if you have all this trouble, nobody's ever treated this?
They just give
Hand?
me pills and stuff. Yeah.
Sure, you have any treatment for this? Just the pills?
Just pills.
Okay, shall we tackle this first? Does either arm bother you?
Yeah, this one here, doc, this is, I don't know why, it's a little bit painful. I was thinking because it's painful here, and when I sleep, I try to sleep on my side, try to pop these bones or something here inside. But sometimes it gives me relief, sometimes don't. But I try to get like warm water sometimes, or take a shower, a cold, I don't know, hot shower.
You ever had therapy, chiropractic, anything?
No.
No? Okay, well, let's see what you have. Just drop your elbow in my hand. Just let it fall. It's a normal shoulder. Hold this up right here. Don't let it push it down. Hold it up. That's normal.
Well, I'm hurting here. It hurts in my back too when you push it.
It's up here. Cut this hair.
And I tried to do it like my
I
time.
used to have clips for it. I think people stole.
No, there is.
Oh, thank you, doc.
You didn't need to fix it.
Oh my god. This is my problem. Okay, now it's thank God. Yeah, I probably have to use my things. I won't be able to. I have my thing here a while in the car, and I was struggling to put it up.
Oh, it don't need my clip.
I have this one thing. There, oh my god.
Okay, now. Does this bother you here?
Yes.
Bring up your hand. Hold it up. Does that hurt it? Where?
It's inside.
Oh, up there, not here. Okay. Shoulder's normal.
No.
Chin down. Which side hurts? The right side
Yeah,
or the left?
this one.
Does it hurt here or here?
That one.
This one here? Or chin all the way up? Chin all the way up. Oh, that hurts?
Oh, that chin no.
Chin up doesn't hurt? You're not going up. So you say it doesn't hurt going up. All right, put your chin right here. Chin. No, drop your chin and then put it on. How's that?
Oh, it hurts here.
There it is. Ugh. You're worse on the left? Okay, so you feel this pain through here?
Yes, though. The pain normally it's right. Sometimes it's inside here.
Yeah, but it's not. See, I moved it already. It's perfectly good. Alright, so the pain that you're having has to come from here. This goes to the side of the arm. And this one goes to the shoulder. This one.
I was just imagining it then.
Well, no, you perceive where it goes. You don't. You knew where it was coming from. You couldn't put it together though. How about this? Does this bother you right here?
No.
No. All right. C5-6, normal shoulder.
Oh, so now I understand now.
C4-5, right? Yeah.
So I feel a pain here, but it's not really somewhere. It's not really coming from here.
No, I have to produce that pain. When I examine you, you did not produce it.
Okay.
Dr. Pannozzo. Speaking.
Machine.
It's still not putting out.
It's black. Look at that.
Jeez, I gotta put this light on again.
Why it's so dark? Seven, 6, 5, 4. This really shows much. Got a headache right there.
Is it the top one? What's strange is like from the lines below, it seems to come out, and then from there up.
Well, bone shows real good, but the rest of it doesn't. Not all the bone shows. This shows, but not the neck.
Yeah.
This shows, but not that. So I don't know, it must be something with the chemicals, maybe. Okay, shall we go get this?
Oh, I'm ready.
It's 2 shots, one on each side. Come on.
Oh my god, that is my worst enemy. Oh my goodness.
You gonna do what? You don't do anything, I do the whole thing for you. You're queen for a day. We do everything for you. All right, turn over. How did you like that?
It's not bad.
Okay.
I expect worse.
Now, it's going to cook for a couple of minutes and then do these fingers too. It's the same shot, okay?
We got my needle. No?
Yeah.
Am I allowed to eat after this? Okay. Yeah, I eat just some bread and some.
You want them all done or just one or two?
Oh, Lord. You think I would survive all of them?
Yeah, yeah. You're going to survive, no problem with that. See, the problem is there's no room in there for this.
Oh, I'm brave enough today. I got 5 shots.
I'm glad you didn't scream.
Oh, dog,
It was a silent scream. She was like this.
yes.
I could hear it in my headphones on.
Okay. This is the best treatment you can get. Yeah, so you're gonna start feeling better already. How's that shoulder?
See if you can move your shoulder.
Yeah. I think I felt better already. What about my knee, doc?
Right. How was it for that?
That was it.
Was it as bad as you thought?
No, it's not. It wasn't. I'm scared of needles. I really am. But anything to make me feel better. What can I say? He can shot right there.
The color neck, can you move?
Yeah. Now I have one problem too. My niece.
Let me see. Let me see the knee. You didn't wear short pants today, huh?
No, I didn't. I wasn't
Slow me
aware.
down.
Next time I'll do that. I'm in pain last night when I got shower. I didn't even bother to
Let me
jump
see.
in the
Well, you
thing.
gotta pull the pants
Oh,
up.
sorry,
I gotta
Doc.
see the knee. Do that
Actually,
one.
this one actually, Doc, it's not swollen, but it's, see right here?
These are normal knees. Nothing wrong with those knees.
So what were those pains? I just have to
They're
make
from
it.
somewhere else. All right, let me see your hip here. And there's one of them. Yeah, this is the worst knee, right?
I think so.
Yeah, and that was normal. This one has a hip component right here. We take care of the hip, the knee pain goes away.
Okay.
So, now here's the problem I have. The doctor who's treating her is a rheumatologist. They treat blood mainly. They don't treat musculoskeletal problems like she has. So she's been diagnosed as RA, rheumatoid arthritis, and I don't have a clue where it could be because I don't see it. But the normal reasons for a pain are there, and we treated them. And your neck feels better already. How's that shoulder?
I could feel a little bit better now.
And then the fingers were, these are
So-
injuries where you can't get the stretch of the
Yeah.
PIP joint, which is this one.
So will this thing, Doc, will it
It's
swollen?
just scar tissue. That was an injury and it's scarred down. Like
So do I have
you
to do
just stretch
something?
it out. You stretch it out like that. They've already been shot once, so that you're going to get an improvement with those. The more you stretch it out by yourself, the better you're going to be. That means I don't have to give you another shot. Those are very tough to take because there's no room in there, in that space there.
Yeah.
So, in any way, you put your chin down, and that's good. Chin up. And chin on your right shoulder.
I feel this thing.
Not good there, go that way. Okay, this is the pain we were after. Is that gone?
I could feel relief. I could tell you it's relief. Yeah.
Okay.
So I thought it was like here it was like banging because sometimes, Doc, I could feel like there's like a air bubble inside.
Yeah.
When I try to pop sometimes it pops and it's like, oh,
Well, you want to stretch your neck when that happens. You pull your head down like this, and then that stretches your ligament structure in your neck, and that'll relieve that. Because that pain wasn't local, it was referred.
Oh, okay. So
You
no
wanna
matter
come-
how much I try to fix this, it
You
won't
wanna-
be fixed.
No, it can't be fixed, because there's nothing wrong with it. You want to come back?
Oh yeah.
Okay. 3-hour trip wasn't so bad?
No, for betterment to feel better, I'm willing to come back.
What I had in mind was we can fix your hip and that'll take care of your knees. And I wanted to re-examine you for your neck, make sure they're the right level, because there's several levels in there that we could treat.
Okay.
So the next one down was a 5-6, which goes all the way down here. We did the only one that goes over here.
Oh, okay.
See, so you gotta follow this stuff around. We don't wanna do too much, but we did a lot already.
Okay. So when do you want me to come back? How?
Oh, it's just about a week.
A week?
It's a long trip.
Yeah, so next Tuesday?
Tuesday'd be great, yeah.
Okay. Whew. Hopefully next time I could come back, I could dye my hair.
But you got relief, right?
Yes, yes. Here, I could feel this one. Oh my god, I don't know how you put the shot and just shove it there.
So you can kind of straighten your fingers a little bit now?
Yeah, yeah. And I don't feel pain, probably because I had injection or something. Is there any restriction for food?
No.
Can eat anything. So the numbness in this one, how long it's gonna last?
I mean, the medicine stays in you for like 8.5 to 9 hours, and then it gets out of your body.
Fort, P as in Charlotte.
And
I've
that's
been there.
Florida, right?
Have you?
It's nice.
Now, Florida,
Yes.
which is it, code?
33954. Yes, sir. Next to Fort Myers.
Sign here.
What is wrong with me? Was out there talking? Huh?
Everybody misses it.
Even with the,
Yeah. Tried to make it larger, but I gotta
probably highlight it.
put it up later.
See, when you get older, Doc, you can't see as good like me.
I know all about that.
You know.
Yeah, this one you took care of, okay. What do you want me to look at, your leg?
Yeah, well, that one's cutting up again because this right here threw it out. This knee, I had surgery on this knee,
Oh, you did?
and and it's been cutting up. I mowed the yard. It's been cutting up, so it had me limping. So it threw me through this, back out, and it feels like this is too heavy to carry. All this is too heavy to carry.
Is that pain going your leg?
Yeah,
Okay,
down.
which part? Down the back or the
yep,
side?
and the back and the groin right here.
Uh-huh.
Yeah.
But it's your left knee though.
It's the left knee that I had surgery on that was the problem, yes.
Operated.
Yeah, but I had surgery on that side of my back right there.
So is the left knee bothering you now?
A little. Last year I couldn't hardly, last week I couldn't hardly walk.
Okay.
Yeah.
Does it swell up or get hot?
It swells and it hurts.
Have a seat.
And it hurts.
And now, your lower back, does that bother you standing or
Yeah, walking
walking?
and standing, yeah.
Does it wake you up at night?
Yes, Lord, I can't get comfortable in the bed.
You got any treatments on it?
Nothing but therapy,
Okay. What
which
kind,
didn't do any good.
what kind of therapy was that? Never does.
Physical therapy where I lie flat down and I would do exercise like this and put my legs
But
up.
you could do that at home. You didn't have
Yeah, didn't even have to pay to get that.
to. No,
Yeah, that's what I had. And then do a bit of good.
no.
No.
Anything else? Any other treatments?
But, no.
Now, who sent you there?
The doctor that did the surgery,
Oh,
Dr. Jabauer, who did the surgery. Yeah.
mm.
And the one that did the knee surgery said I didn't need therapy. And I said, yes, sir, I do. He said, you don't need surgery.
Okay, so,
Yes, sir.
where were we?
I'm talking about this surgery. Doctor told me I didn't need therapy. And I said, yes, sir, I do. He said, no, you don't.
No, it's a good knee.
Huh?
It's a good knee.
It's a good knee? Well, the pain
Not as
don't
good
come
as that
back.
one.
Yeah.
Not as good as that one. This one has a contracture in it right here. See? And you're walking on the front.
Okay.
That's why it hurts so bad.
Mm-hmm.
So one of these days it's going to give out on you. Because the angle that you're going to bear weight on,
Mm-hmm.
it's supposed to be straight, but yours is this way, so
Mhm.
it's going to go
Mm-hmm.
like that.
Mm-hmm. Mm-hmm. Yes, sir. You right. You talking now. Yeah. Mm-hmm. But this thing back here, should I need 3 or 4 back here, Doc? Ooh.
Well, we haven't looked at that yet. All right. The right knee is normal. Okay, I'm gonna rotate your hip here. Let me have it. Wait a minute, don't help me. Oh, yeah. You have two bad hips there. Nobody ever picked this up on you? Really?
No. Yeah, this hip bothered me too, but this is what I had surgery on. Yeah.
You had surgery on your
I had it on
right hip?
this one, on the right back, right side of my back, and it feel like my hip because it hurts from there
You
down.
had hip surgery?
No,
Oh.
my back, but
Oh,
it
you had
feels
back
like my
surgery.
hip because
Oh,
it hurts from there down.
So you had a laminectomy. What year was that?
3 summers ago.
Three.
2013.
Okay. Yeah, August.
Did they do a fusion there or just operation?
He put two
Screws.
U-shaped things in my back. 2 U, and then he put staples in it.
Yeah.
2 U-shaped. Lumbar 4, lumbar 5, something like that.
Is this the same pain you had? I don't even think you had back pain. It was a hip.
Okay, well, that's it.
I'm showing you the hip right now. When your leg doesn't come up, that's a hip. Okay, stand right here. It's worth the trip over, isn't it?
Yes, sir. Oh, you know it. I got up at 5.
Turn this way.
I was riding since 6:30. Yes, sir. And all the other people I'm sending, the people that from Arcadia. Yeah.
Ooh, I can't show you this. Okay, go ahead and bend
What,
forward.
sir?
I just want to know if it hurts. Go ahead,
Oh,
bend forward.
this way?
Keep your legs straight. Does it hurt anywhere?
Yeah.
Go ahead.
Yeah.
Down. Where does it hurt?
Right there.
Right here.
Oh, yeah.
Oh, right there. Okay.
Mhm.
Bend back. Over, back, towards me.
Oh.
How's that? Not as bad though, is it?
Not as bad, but it hurts.
Go left.
Oh.
Is that on the right also? Out here.
Yeah.
And to the right.
Oh.
What?
There again.
There it is.
Yeah, it's all, I need 3 or 4 over there. And one right there. Yeah, it's all over there. Slight over here, but over here is the problem. Bad problem.
Okay. All right, have a seat. All right, so far you have 2 bad hips, but they're treatable. They're just shots, and they come right out. That will relieve your knee. You don't have any knee problem here, essentially. You know, you have a little contracture back there, which is treatable in 2-3 days. But you see, you're so far away, you can't get it. But anyway, you can come
Can't
back.
get it done, I'm gonna come back.
Oh, okay.
Well, I'm coming back. You see, I came back this time, and I'm sending all them other people. Yes.
And then you have the surgery there. There are 2 areas in your lower back bothering you. One goes straight down and one goes off to the side. So, where's your shoes? Okay, we're gonna go down. It feels better already immediately.
That feels better right there.
You bet.
Oh, wait, here it is.
She's got this cage in there. Actually, it's not a big cage, it's a small one.
Oh, because of her back.
Yeah, and your knee's gonna improve.
What is this thing I gotta buy? I gotta buy one of these, right?
We're buying that one.
What is it?
What? Half inch. Half inch.
Are we going in?
You can show it right.
Yeah.
This is the top of this one, and the top of this one is up here.
Mm-hmm.
So I'm calculating this.
Yeah, I see it. I see it like crooked like
And it's
this.
supposed to be straight.
Yeah.
Plus you have a knee, left knee is crooked. And it's still taller than the right side. So your right leg is really short. So I picked a half inch. And here's your cage they put in, staples.
Wow. That's different.
But I think the whole thing was unnecessary. If they knew what they were doing, they would have never operated you. The knee or the back. Yeah. But you don't know, and they don't know either. If they only knew what I know,
And they don't. That's why I
And
came
they
here. No, they don't. And they don't.
How could you live with this praise? I mean, it's very nice.
Yeah.
Anyway. Now, your hip is going to straighten out too. Now, the reason your hips bother you is because this angle is short and this one's long. Short and long. Short and long. That's the angle of your hips. Now, once you wear that continually, your hips are going to straighten out, they'll stretch right out, and your knee will stretch right out. Then you can come back and visit me.
I want some shots.
In about,
I want some shots, Doc.
where do you want them?
I still want some there. Please. I draw.
No, we're going to do your hips.
Hip.
Yeah, we'll do your hips, and that will do much better for you.
What
The back
about
will
this?
take care of itself.
Oh, yeah.
And then you want me to look up here, okay?
Yeah, this. I wanted some shots, especially there in that groin. For that. Yeah, I want to be able to. I don't do that now.
Bring your hand up more. Dee-da-dee-da-dee-da-da. See if we can get it right. First time. Well, we're off. We're off to see the wizard. We're there now, right? Boy, you're some specimen, let me tell you.
Yeah? Is that good or bad, Doc?
It's good, of course.
Is it? I hope I'm good. I sent a lot of people, and they're still coming. Multiplying. They're multiplying, yeah. All from me. I said, I got to see that movie.
You know, it's impossible not to do this and record it all, because these are such cases, just these two alone, tell you what kind of stuff is going on out there. This is why we have these programs on, just to teach.
Yes.
We get the results, and we get them today. And no surgery involved, no therapy, no nothing. We just do it all.
Yes.
And so it'd be a shame not to tell the story.
Yes. Yes. Needs to be told.
Okay, that one's done. You
Okay.
want to go for that one, or?
Yeah, I'll do it. And,
Sure?
and back there. Yes, sir.
Well, I thought that was okay now.
Yeah. Yeah, we're walking, but I still want some back there.
Well, let's do that one then.
This one? Okay. So I turn over on my tummy.
Stomach, but I didn't think you had the back. Let's take a look at it. Turn it over.
Oh.
Roll over.
Oh, this way.
Don't get up.
This way.
Yeah. We got that one, right?
Yep.
Is this where it bothers you?
Right there, right.
Oh,
That
right
knot
there,
right
okay.
there, Doc. That's a
4 foot.
knot.
All right, I got it.
Yeah.
All right. We gotta take a picture of it.
Okay.
There's a scar there, and it's a 4-5
Okay.
doing it. And,
Her sandal might be in the way.
Feel it again?
Should be right here.
Oh, yeah.
This one goes here.
Uh-huh.
Okay, that's the one.
Uh-huh. Yeah.
That's that same spot on the right, right?
Pardon?
That's the same spot on the right that we see a lot. No?
What you talking?
You know how it's pressed down like on the right side of a lot of people?
No, I don't make it.
Deja vu, huh?
Yeah. Not for him though, but for me.
Yeah.
I had a deja vu. He didn't have the same deja vu that I had.
I've been seeing it over and over again.
You know why it wasn't the same day?
Wasn't the same day?
The deja.
Well, that's a bourgeois day. Instead of a deja vu.
Okay.
All right, see if we can do you some good, kid. We were right on there, weren't we?
Yeah, I think so, huh? Oh. Ooh. Mm. Here,
No, not that one.
not
This
that
one.
one.
This one.
It feels like.
You weren't pointing to that one. You were pointing to this one. This is another one. This is higher. You want that one?
Mm-hmm.
I don't know how you're gonna handle all these shots.
What I have?
It's another shot.
Yeah, well, I'll be okay. I came for these dogs. I came for it.
You're paying.
Yes, I did. I came for these. You did.
All the way from Fort Charlotte.
Yes, sir. I would got up at 5. I was on the road at 6:30.
Wow.
And called in at 7.
You don't take 95, do you?
Yes.
Or you do? Okay.
Yeah, I came up. I came through Okeechobee and I took 710 Indian Town.
Yeah.
And I made a left on what 706
Yeah.
and got on I-95. I could have come on down and took 708, right?
Yeah, I think so.
Mm-hmm.
I've gone like to Port Charlotte lots of different
All right,
ways.
now I gotta find out which one we're after here. This is a 5-1-4-5. We just did. Is it this one
Mm-mm.
or this one?
Mm-mm.
This one. No, this is not your hip.
Mm-mm.
This is a referral area, but I don't know where it's from. How about this one? Any of this bothering you?
That's your soul where you was.
Right here?
Down. There.
That's the right one. 3-4 left. There it is, right on it.
Yeah. Oh, yeah.
Scar tissue all around when they operate you.
Mm-hmm. Okay.
That's why we don't like it.
And I got a brother and a wife that lives here and they want to come, so I got them a card. They live in Delray.
They live in Delray.
Yep, and they never knew about you.
No kidding.
Yep.
All right, Darren.
Then we look at this.
Oh,
I'll
we
be
can't do
back.
any more shots. We gave you too much
Okay.
medication already.
All right.
No,
Next
that's
month.
gonna straighten out. You'd be surprised.
This is gonna
Yeah,
straighten-
just wearing the half is gonna straighten your whole thing out.
Okay. All right,
You
Doc.
gotta come back anyway for the
Yes.
other hip. Yeah.
Yeah, you know it.
You see your
Oh,
x-ray?
that's what.
I wanted
my
you to
phone.
get your phone. Where is it? In the other
It's
room?
right there. Yeah, in the other room.
I'll get it.
Okay. Thank you. Yeah, I'm coming back. No problem, Doc.
Yes, sir. Yes, sir. I got to come back here before my insurance goes up and all that foolishness starts.
Oh, yeah.
Yeah, in January they're supposed to raise our stuff and all that crazy stuff. No.
So you got some relief, right?
Yeah.
Even with just that foot thing, you got some relief now.
Yes.
But now with the
Let me
injection,
get up and walk now. Yeah.
I know you got to leave.
Oh, what a relief. Thank you. Awesome. Oh, I feel 100 times better. Oh my goodness, yes. Oh, awesome. Oh. Hi, Dr. Pannozzo is awesome. I feel 100 times better. I'm glad I came. I will drive 5 more hours just to come back if I need to. He's worth every minute of my driving and every penny that he gets, and then some. He's awesome. Thank you, Doc.